This is Sally. She is an occupational therapist and is on her way in for a day at work. What is this? She spots her fellow occupational therapist, Frederick, soliciting an alternative business card. Sally recognizes this as a conflict of interest. Enjoying a peaceful lunch, Sally is curious of the nature of the business card. Frederick happily explains that he is also a yoga instructor. Sally is intrigued and inquisitive of Frederick's training. He explains that he has been practicing yoga for years and received a certification over a weekend course. Sally wonders if this modality is suitable for the client, and how long has this been going on, and does Frederick bill as occupational therapy services? Sally is covering Frederick's client because he's out of town. Pierre is a longtime client diagnosed with breast cancer and lymphedema of the left upper extremity. While treated, Pierre cringes with pain. Sally asks Pierre if he's gone to one of Frederick's yoga classes. Sally wonders if Pierre's pain is caused by Frederick's yoga and thinks of what steps she could take to address this ethical dilemma. After work, Sally researches the steps to deal with this ethical dilemma. She thinks of whether or not to confront Frederick or to report him. Sally thinks of all the players that could potentially be involved. Frederick, Pierre, herself, other clients that are seeing Frederick at his complementary alternative medicine clinic, the State Regulatory Board, the American Occupational Therapy Association, the clinic in which they work at together, the families and friends of Pierre and Pierre's insurance company. Then Sally considers all the information she knows. She knows Frederick has a private practice where he teaches Pierre yoga. Pierre is complaining of pain in his left elbow. Frederick gives clients at work his private practice business card, which is considered a conflict of interest. Frederick also took a one-day workshop for training in teaching yoga. Then she considers all the information that she needs to know. How is Frederick billing these services? Was the training he received from an accredited school or program? Does he have a certificate of training? Does he do any occupational therapy modalities at this clinic other than complementary alternative therapy? Does he do extensive chart reviews of clients prior to treating them with these complementary modalities? Do physicians recommend these modalities to their patients? How long has Frederick been treating clients at his private practice? Sally uses the AOTA's Code of Ethics and looks for other posts related to the topic on the Occupational Therapy Connection page. Sally contemplates what to do in this situation and has come to several options. The first is that she does not report Frederick, potentially causing Pierre more harm and breaking an ethical principle of non-maleficence. This could also cause Sally ethical distress due to issues with relations in the OT department at the clinic. If Sally does report Frederick's actions, he could lose his job, be suspended, and depending on the details of his billing at the private practice, could lose his license. Sally decides her best course of action is to confront Frederick tomorrow at work. Sally notices Frederick on his coffee break and asks for a moment of his time to discuss the client, Pierre, and his rehabilitation. Sally informs Frederick of her concerns about the outside practice as it relates to the Code of Ethics and possible repercussions from the Ethics Commission and the State Board. Frederick explains to Sally that the pain that Pierre displays is related to his arthritis, not the yoga. Frederick shows Pierre's progress in his case report and concludes that the yoga has actually been helping Pierre tremendously. Sally also finds that Pierre's physician has recommended yoga. Frederick goes on to explain that his yoga practice is a voluntary alternative therapy on the weekends, unrelated to his occupational therapy services.